Chemical peeling is a dermatological treatment that uses a chemical solution to exfoliate and remove the top layers of the skin, promoting the growth of new, smoother, and healthier skin. It is commonly used on the face to address various skin concerns, such as benefits of chemical peeling for the face. 1. Reduction of fine lines and wrinkles. Peels can diminish the appearance of aging signs, especially around the eyes and mouth. 2. Improvement of skin texture. Helps smooth rough skin and reduce uneven patches. 3. Acne treatment. Certain peels, like salicylic acid or glycolic acid, can unclog pores, reduce inflammation, and diminish acne scars. 4. Hyperpigmentation and sun damage. Lightens dark spots, melasma, and sun-induced pigmentation. 5. Brightening the skin. Leaves the skin looking more radiant and even-toned. Types of chemical peels. 1. Superficial peels. Use mild acids, e.g., alpha-hydroxy acids like glycolic acid, to gently exfoliate. 1. These are suitable for mild skin imperfections and have minimal downtime. 2. Medium peels. Use stronger acids like trichloroacetic acid, TCA, to penetrate deeper. 2. They address moderate wrinkles, pigmentation, and sun damage. 3. Deep peels. Use powerful agents like phenol to treat severe wrinkles, scars, and damage. 3. These require longer recovery times. What to expect? 1. Preparation. Your dermatologist may recommend pre-treatment products to prepare your skin. 2. During the procedure, the chemical solution is applied to the skin for a specific duration and then neutralized or washed off. 3. Aftercare. Expect redness, peeling, or mild irritation depending on the depth of the peel. Use sunscreen and avoid direct sunlight as your skin will be more sensitive. Moisturize and follow your dermatologist's post-treatment instructions. Risks and precautions. 1. Side effects. Redness, swelling, or scarring, rare in skilled hands. 2. Not suitable for active skin infections or severe eczema. Individuals with darker skin tones should consult a dermatologist to minimize risks of post-inflammatory hyperpigmentation. 3. Patch test. Always do a patch test to check for allergic reactions. Consult a dermatologist to determine which type of chemical peel is suitable for your skin type and specific concerns. Avoid DIY chemical peels unless using dermatologist-approved products for home